This video is titled Sacroiliac and Pelvic Palpation, Lower Half. Hi, my name is Jerry Hesch. I live in Henderson, Nevada, which is very close to Las Vegas. I practice physical therapy, manual therapy, part-time, and we very recently obtained state status for a nonprofit organization to be announced shortly. This is my current website, heschmanualtherapy.com. I've been wanting to make this model for quite some time. I am happy that I finally did so. And I remember a dear therapist from Georgia, Gordon Cummings, who has since passed on, advised me of palpating the medial border of the ischial tuberosities when palpating the pelvic structure and doing a sacroiliac screening exam. And it certainly got my attention. And as I started to do that, I started to see that there were times when there was an asymmetry of the lower half of the pelvis when the upper half was symmetrical. Now, these are bony fused structures on each half, so you wonder how that's possible. But you need to think in terms of where the axis of movement is. And if the axis is very close to the upper landmarks, perhaps in the middle of it, but further away from the lower landmarks, whichever direction that is, that starts to make sense. So I also started palpating this flat portion of the ischium. I believe I'm the only person that does that, at least in the literature. But I think it's very, very helpful to do so. And of course, I encourage palpating the sacrotuberous and sacrospinous ligaments, which are right here, and give a lot of information regarding positioning of the pelvis and position of the ilium and the sacrum, etc. Now, the other half is in the front. The traditional exam of the pelvis SI symphysis pubis joint involves palpating the crest on both sides and palpating the tubercles on both sides. To that, I recommend walking down the face of the pubic bones and also crossing over the fibrocartilage. And sometimes you will find a painful fibrocartilage that is moved slightly posterior that is treatable. Very rarely you will find one in which the cartilage has descended somewhat and is treatable, in which as you walk across you'll find a divot. Other times you'll find a pure posterior glide of the entire face, which is a pattern that I have described and is not described in the literature. When I started palpating the lower symphysis pubis, I was astonished to notice that sometimes you would have asymmetry of the lower half, and yet you would have symmetry of the upper half. And again, it has to do with where the axis is, and obviously the axis, which would be a transverse oriented axis, would be much closer to the upper portion of the pube. And I discovered a sequential pattern which certainly challenged my thinking for some time, and it basically involved a lower pubic rotation, but also an external rotation of the lower half of the pelvis. And when you check, again, all the upper landmarks, which are the classical ones that are palpated, you didn't see that asymmetry. But down below, with palpating the medial borders of the ischia, the posterior flat portion of the ischia, and the lower part of the pubic bones, you did in fact encounter it. And the way I realized that it was a rotation was that after I treated the rotation in the symphysis pubis, and this became symmetrical, and symmetrical with spring testing also. I then had the client lie symmetrically and prone, and I came and palpated, and this ischium was still somewhat posterior, yet it had normal PA spring. So I continued to work with the model and developed a way of springing lateral to medial on both sides, and then medial to lateral, and palpating the ligaments, and came to realize that there in fact is a pattern of external rotation on one side coupled with internal on the opposite side, and with that is a lateral mobility on one side, which I will call abduction of the lower ischium, of the lower hemipelvis, thank you, and adduction of the opposite side, of the opposite hemipelvis, noted again in the lower half of the pelvis. So I developed treatment techniques for that, and I think that's the main point that I want to make of this. Now, of course, we are taught to palpate the lower half of the sacrum, and we are taught to screen the coccygeal joint. And I think that I've made all the major points that I care to. I certainly like this model. I've been wanting to make it for such a long time to convey that, and I think it conveys it very well. So I'll stop here. Thank you very much.